Now, for couples struggling to have children, IVF is one of the best techniques used to help conceive a baby. It doesn't, though, guarantee success, and couples often have to have, well, several attempts. That means it is very expensive for the NHS, with each round costing up to £5,000. Well, now one borough is planning to become the first in London to cut the free treatment as a way of saving money. Victoria Cook reports.
For some, playing in the park with their children is a dream, but nature won't allow it to be a reality. When couples face a problem conceiving, they can turn to the NHS for help. Here in Croydon, though, that soon may not be possible. The local health service says it needs to save money, and it's suggesting scrapping all IVF services.
We're talking here about people's access to health, and this needs to be consistent across London so that it's fair and equitable for everybody involved.
Last week, the Health Secretary, Jeremy Hunt, said plans like this weren't acceptable. He said no budget savings should impact on patient care.
If this happens in Croydon, it will be a very dangerous precedent. We've seen 3 areas in the east of England decommission their services entirely, with others threatening similar action. And if Croydon takes this step, then I really worry that others will seek to go down to the lowest common denominator.
Croydon Clinical Commissioning Group says it hasn't got a bottomless budget and it has to make difficult decisions. It has said, though, it wants to reassure residents here that it hasn't made any certain decisions and it will consult the public.
I don't think it's very fair to moms, well, not to moms, but to women who live in Croydon and try to conceive and they can't do this.
I conceived naturally, but it can happen to any lady, to my sister, to my friend.
It's definitely something I would have explored, if I couldn't have children without IVF treatment. It's something that, and to know that wouldn't be available and that wouldn't be an option, it is quite shocking.
When it comes to IVF treatment, where you live can make all the difference to the care you're given. For example, if you live in Camden, you're entitled to 3 chances at conceiving through IVF cycles. But in neighbouring Haringey, you can only have 1. Croydon's consulting on whether to take away that entitlement altogether, which will make it similar to parts of Essex. Across all the boroughs, there are different rules. For example, the woman's age, whether either the man or woman has had a child before, and how long they've been together. Croydon Health Services need to save nearly £6 million. IVF cost the borough just under £800,000 last year. Now the debate starts on whether this is a saving worth making. Victoria Cook, BBC London News.